Africa, she is most likely to be murdered by an intimate partner. This form of homicide is known as intimate femicide. Gender and Health Research Council conducted a research recently comparing female homicides in 2009 with the situation in 1999. Now, the 1999 study showed that a woman died every 6 hours. That's 6 hours at the hands of their husbands or their boyfriends. We're now joined by Professor Naeemah Abrahams, who is the Deputy Director at the South African Medical Research Council. She's in our Cape Town studios. Thank you so very, very much for joining us, and welcome to Morning Live.
Pleasure, Leanne.
What is femicide? Let's just talk about that. What is femicide, and what are the causes of this violent act towards women?
Femicide is the killing of women in general. But more particularly, as you explained earlier, we look at who killed the woman, and we call it intimate femicide if a woman is killed by her partner, her husband, an ex-partner, an ex-boyfriend, a dating partner, somebody with whom she had an intimate relationship with.
Do you think gender-based violence prevention that's put in place in South Africa is actually failing the women of this country?
I actually think we do not have any good prevention interventions here. We do not have a very good plan, a comprehensive plan. Basically, there's many ad hoc activities. There's raising awareness here. There's raising awareness there. There's lots of secondary prevention where a woman has been raped maybe, or she's been hurt, and she's able to go to police. That is prevention, or helping a woman after it happened. But primary prevention, where we look at completely preventing violence from happening at all, have not really been given the attention it needs in our country. There's no comprehensive plan, and we hope that this will be different. We hope in the future, very soon, that our government, working with civil society and NGOs, will come up, as we've done with HIV, that we come up with a real comprehensive plan.
Yeah. How can our justice system play a role in reducing this violence against women? I mean, we've got a department that focuses entirely on women. You know, we try so hard to put women at the front of everything, and yet it's still not working. What would you like to see happen?
I would like to see all government departments working together on this. As you said, Justice Department has played a big role in our country. They have, but again, the Justice Department role is after a crime has happened, after a woman has been killed, or after a woman has been raped. Our role and our focus should be on primary prevention, as I said. So it should be social development, education has a role, health has got a role, and particularly working with children and working with young boys, preventing them from going on a path where they use violence in all kinds of ways against women, against young other boys. So that should be the focus. Yes, we've got a Department of Women, Children, People with Disabilities, and there's a board that we have at the moment. But really, we're looking at them coming up with a plan. They're not an implementation department. They're really a department that look at developing policies and looking at monitoring the policies and making sure that people come together and develop a comprehensive plan.
What about gun control legislation and perhaps strengthening this? Do you think this could assist in the reduction of intimate femicide?
Absolutely. Now, this is the one good story we have in our country, if I can use that phrase. We have shown between 1999 and 2009, the number of gun-related deaths decreased dramatically. This is the one area where women in 99, a third of the women killed in 99 were killed with a gun. By 2009, this has decreased to 17%. And we can only equate that to the Firearms Control Bill. So here is a government policy, a government act that's working, even though it has got problems, but it certainly is working, and it must be strengthened. We should not tinker with it and try and decrease its effectiveness.
All right, thank you for joining us. There's so much more to talk about. Unfortunately, I've got to wrap it there, but thanks for talking to us. And Naeemah, who is in our Western Cape studios, in our Cape Town studios, Naeemah Abrahams is the Deputy Director at the South African Medical Research Council. All right,